Acute effects of the elevation training mask on strength performance in recreational weightlifters. An elevation training mask is an adjustable inhalation exercise device. In other words, it restricts the amount of oxygen one gets during inhalation. The idea behind restricting oxygen intake using these kinds of masks is to simulate the conditions of high-altitude training. The purpose of this study is to examine the effects that an elevation training mask has on resistance exercise performance, markers of metabolic stress, and mental fatigue. 25 healthy, resistance-trained men were chosen to participate in this study. They had to be regularly participating in the resistance training program for over 2 years and be able to bench press their body weight and squat 1.5 times their body weight. Subjects were randomly assigned to work out with or without the elevation training mask in the first session.
The entire experiment consisted of 4 sessions. The first session was a familiarization session. The subjects were introduced to the equipment and the entire experiment. During the second session, baseline measurements were taken for both back squat and bench press. Both exercises were evaluated using a 5-rep max test on a Smith machine. Half of the subjects were randomly selected to wear the mask for session 3, while the other group did not wear it. For the fourth session, both groups switched off. During both sessions, the subjects completed a questionnaire to assess baseline feelings of focus, energy, alertness, and fatigue. 85% of their predetermined 5-repetition max was used while they performed 6 sets of 10 repetitions for both exercises. The subjects also completed a 25-second maximum sprint. Peak velocity, average velocity, and total training volume were measured during the squat and the bench press. Peak velocity and average velocity were also measured during the sprint, and after the sprint, the blood lactate and oxygen saturation were measured.
As a result, peak and average velocities, blood lactate levels, and oxygen saturation levels were decreased for the bench press, squat, and sprinting tests for the subjects wearing the elevation training masks. This lowered the overall training volume and energy for conditions with the mask compared to subjects without the mask. Also, significantly lower ratings of alertness and focus were found after squat, bench press, and sprint tests in the elevation training mask condition compared with the no mask condition.
So if you're considering getting an elevation training mask, in order to increase your performance during training, you should take into consideration that the ETM may hinder velocity of movement during training and result in physical discomfort. The use of an ETM during training may impose a risk of adverse effects and should be considered before implementing the device into the training program. If you decide to invest in an elevation training mask, make sure to thoroughly familiarize yourself with the device before using it in training in order to prevent any negative side effects.